So good morning everyone and welcome to the new trainee welcome day for Histopathology. Thank you all for joining us this morning. My name is Ronan McMullan. I'm Clinical Director for Training and Assessment at the College, and I'm opening today's webinar, and then I'll hand over to one of my colleagues to finish off later. So we have lots of speakers for you today, and we hope you really enjoy this session and learn something about the college from it. First of all, I'd like to welcome you to the college, because this will be the first experience of many of you. And I'd like to welcome you to having chosen a career in a pathology specialty. I hope this morning will give you an insight into what your training will be like, and I hope the pathology gives you a challenging and fulfilling career long into the future. So the main purpose of this morning's webinar is to give you an overview of how the college will support your training, and to give you some insight into what the college does, both in terms of how you might interact with the college during your training and what we do more generally outside of training. So before we begin, I've just got a couple of housekeeping points. First of all, we'll be recording today's session, and that means that if you want to look back at anything that you have forgotten the details of, you'll be able to do that, and the recording will go on the college website in a week or two. I would like to reassure you, though, that your names won't be seen in the playback, so no one will know, no one who views this recording will be able to see that you were here. I would really encourage you to ask questions. We've got lots of really well-informed speakers who will know all the answers to all of your questions, so please do feel free to ask the questions. And the way we'd like you to ask questions today is by typing them in the Q&A function that you can find down the bottom of your screen. And what will happen is at the end of the session, we'll pick up on your questions and deal with them then. There are no mics and no cameras enabled for any of the webinar participants, so that's the only way that you'll be able to ask questions. And finally, at the end of the session, in the chat, there'll be a link to a feedback questionnaire on Slido, and we'd really appreciate you filling that in if you don't mind. So to kick us off, I'd like to welcome the college president, Dr. Croal, who is going to give you an overview of the college and a welcome to today's session. So I'll hand over to you, Bernie. Thanks very much.
Thanks very much. Welcome everyone. My name's Bernie Croal. I'm just making sure I'm coming up on screen. Can someone confirm that? It's not on my screen.
Yeah, I can only see you at the minute, Bernie, not your slides.
I haven't got slides. It's just me.
Okay.
Yeah. Perfect, thank you. Well, good morning, everyone. My name is Bernie Croal. I'm the current college president. I'm just over halfway in my 3-year slot. I am college president until the end of 2026. It's a great pleasure to welcome you to the college. As Ronan said, you know, this is for most of you the first time you've had connection to this college, and hopefully it will be a connection that lasts for your entire careers, and even beyond that. We have many retired fellows who are still active doing things within the college as well. You'll begin to realise, if you haven't already, that pathology is hugely important to healthcare, and there's various statistics out there. For example, over 95% of healthcare interactions involve pathology services, and this ranges, you know, from blood tests to histology to a whole multitude of other tests, and also clinical services as well. Histopath disciplines make up the biggest chunk of our 17 disciplines, making up about 43%, I think it is. But the rest of pathology is largely clinically based as well. And myself, I'm a chemical pathologist. I work in Aberdeen in the NHS, and you know, I spend most of my time, you know, seeing patients in outpatient clinics and doing ward rounds and so on. But even within Histopath, it's important to realise that it's not just about sitting in the lab looking at a screen and looking at down a microscope or doing a bit of cut up. It's also about interacting in large, wide, multidisciplinary teams. So the sort of expanding clinical relevance of Histopath is going to become much, much more important as we go forwards. Not just diagnosing, but actually using that information to provide important and vital information about how we treat patients. And indeed, many of the histopath-based tests that we do now will actually define what drug treatment patients with cancer get, for example. So 17 different disciplines. There's a whole variety, as I've said, and we're all sort of under the one sort of diagnostic family. And there are other diagnostic groups across healthcare, notably in radiology, and we work quite closely with them, and less so with the other diagnostic entities outside that, but we still have a lot of connections as well. So what about opportunities as a trainee and even as a future consultant? I think one of the things I would like to stress is the importance of thinking about getting involved in teaching and also in research. There are lots of opportunities to get involved in teaching, not just within the pathology family, but within undergraduates, other postgraduates, and also across the whole healthcare careers, including nursing, including various groups that you work with in your daily job. For me, I work closely with pharmacy and with dietetics, and so we do a lot of teaching within those groups. Research is still very, very important. I would say it's less easy to access in the pure academic sense than it was before. But even within NHS-based jobs, there's a huge opportunity to get involved in research. Pathology tests are incredibly important for most clinical-based research projects. So it's about trying to get involved with various teams, with various ongoing research projects that are always there. When I was a trainee, I was told right at the start, get involved with as much as you can, be very helpful. To be fair, some you win, some you lose, but if you're not doing it, you never get a foot in the door. But as I say, there are lots of opportunities out there, and it's a great way to make yourself known, not just in your own department, but across the whole hospital or area that you work in. So the next bit really to cover is about why is the college important. I think it's fair to say that Royal Colleges in the last few years have got a bit of stick for various reasons, but we should always remember that colleges are vitally important, not just in your training period, but in your future careers. Colleges are not me, they're not our building, they're not our staff, it's all of us. And the whole profession is hugely dependent on what the college does, what the college says, and what the college gives back to you. We have over 10,000 members and fellows, and every one of them is part of the college. We're a relatively young college. We were formed in 1962, and so in many ways we haven't been around as a college for a long period of time, but we still nevertheless operate like all the other colleges. So it's not all about examinations, which is the main focus that you will have and the main linkage you will have with the college in the coming years. It's also about all the standard setting, all the guidelines we produce, and increasingly important is the professional area, especially how we advocate for the importance of pathology with government and various other groups. Only last week I was able to spend an evening with the Secretary of State and various other ministers, and also as part of the Academy of Medical Royal Colleges, we're able to interact within the wider group of college presidents and ensure that our voices are heard. But as you know, there are some harsh truths. healthcare in the UK is not doing very well just now, as I'm sure most of you are aware. It's hard. It's very difficult. We know that to do the jobs that we want to do, that we ideally want to do, that patients need, we would very much stand up and say that the NHS in particular is under-resourced and understaffed, with a huge amount of impact on waiting lists and all the other financial pressures that are out there. We know that pathology departments are, in general, quite run down and need a huge amount of investment. And these are areas that we will constantly strive to make the case for. So it's important, to recognise that the college is very much standing up and speaking out for the whole profession and the whole number of 17 disciplines within our college. You're going to hear from lots of much more informed people than me today about things like exams, but it is something that is an unfortunate part of training. It's a necessary part, and it's a very important part. And we absolutely recognise that exams are expensive. As a college, we have a very complex set of examinations to deliver, and we do it on a relatively shoestring budget, and we don't make any profit from exams, and we deliver multiple stage exams for 17 disciplines and some other groups as well, such as medical examiners and so on. We have a very small but dedicated team backed up by hundreds of volunteer examiners who all provide that input in their own time. We don't pay them for that. As I say, we don't make any profit, but we do keep the cost as low as possible. But we absolutely recognise it's quite a substantial amount to be forking out. But we can only assure you that we will try our best in the future years to make that as small as possible. But remember, there are tax rebates and so on that you can use in order to soften that blow. So your journey with the college begins now and will hopefully span, as I said, your entire career, supporting you not just in your training period, but providing you with much needed CPD, education, guideline standards, and of course representing the profession to government, the media, and the public. But as I said before, the colleges are not a them and us situation. We are all largely volunteers, including me, and we are all part of the college. So this is not my college. It's not even your college. It's our college, and it's important that you align with what the college is doing, be aware of what the college is doing, and support it as much as you can. There's lots of things you can potentially get involved with, even as trainees within the college, and I would urge you to look at our web pages and see what opportunities are out there. So I want to wish you all the best in your future careers, especially in this training period that you're now entering. And I think, the bottom line, certainly for me, is I've never regretted my choice. There are huge, I think, lifestyle advantages by going into pathology disciplines. For many of you, it'd be the first time in your working careers, at least, where you won't have to work in the evenings or at weekends as part of your job contract. Of course, that doesn't mean to say you work any less, because many of you will be volunteering to work more, to study, to prepare for exams, and indeed, certainly when I was a trainee, I was keen to spend as much time as I could. So I don't think you will regret your choice going forwards. Histopath has many challenges in the future, especially around the integration and the rolling out of digital pathology departments. Many departments are already fully digitized, but many are not. and we have to keep pushing that, keep pushing for funding with government. And there's also the unknown area of AI, which I'm sure you've heard about in terms of the potential. Personally, we certainly in the college advocates that AI is going to be important, but it will not replace us. We will just be working alongside it, and it will make our jobs different. AI is something again that as a college we've very much switched on to, and we will look to try and develop that. So I'm going to sign off now and hand back to Ronan. But as I say, welcome to the college, and I wish you all the best in your training period. Thank you.
Thanks very much indeed, Bernie. That was a really nice summary of pathology in general, and a bit about what the college does too, so that's great, thank you. So for the rest of the morning, you're going to hear about a range of things. You're going to hear a little bit more about what the college does. You'll hear about your curriculum and the assessment system embedded within it. Of course, I know you're all looking forward to hearing about the RCPath exams in your specialty. You'll hear about your ePortfolio, and you'll hear about the pathology portal and how you might be able to use that as a learning resource throughout your training. So I thought we'd just pause for a moment and introduce a few people who are really key to your training within the college. And I'm going to begin by focusing on the training team. So a lot of what happens within learning in the college is led by the Director of Learning, Joe Brinklow, and you're going to hear from Joe in a little while, so I'll not introduce Joe just yet. Within learning then, we have the training team, we have the assessment team, and we have the pathology portal team, and so they all have some key roles in your training. So I'm going to begin by introducing the training team, and from the training team today we have Jenny, Louis and Adabi, and I'll maybe just give each of the three of them a chance to say hello. So shall we begin with Jenny?
Hi everyone, I'm Jenny McGinley and I'm the training manager at the college. I'm in charge of the training department who are here to support you throughout your training.
Thanks, Jenny. And Louis?
Morning everyone, I'm Louis Nyerere. I'm the training officer at the college and I look forward to working with you during your training.
Thanks, Louis. And Adabi?
Hi everyone, it's Adabi Akufo. I'm the training coordinator at the college and I look forward to hearing from all of you during your training.
Thanks, Adabi. So the training team look after queries from trainees and from your trainers, and they process the paperwork, very importantly, when you arrive at the end of your training and are ready to receive your CCT. So you have to keep on their good side. Now, we also have the assessment team with us today, and that's Sandra and Eva. So you're going to hear from Eva later on, but maybe I'll ask both to introduce themselves to you. So Sandra.
Hi everyone, I'm Sandra Dewar. I'm the assessment manager in the college, and my remit from your perspective is to do with the LET ePortfolio and also a bit about the pathology portal as well.
Thanks, Sandra. And Eva?
Hi everyone, my name is Eva Takacs and I'm the ePortfolio officer, and you will hear a bit more from me after the break.
Great. Thanks very much, Eva. We will indeed, and look forward to that, because the LET system is something that all these guys will really want to pay attention to get to grips with. We will also have Luke Thrower, the pathology portal officer, but I don't think he's joined us yet. His slot is a little bit later on, and Luke likes lying on a Friday morning, so he's not online just yet.
He has sent in a recording, Ronan.
Oh right, that's good.
Yeah.
That's quite a lie-in today, Sandra. Okay, thank you. That's great. Okay, so we also have lots of other people who you'll hear from. We have Dr. Ed Cheesman, who is the chair of the training committee. We have Dr. Shafiq Gill, who is the chair of the examiner panel who is the chair of the histopathology examiners panel. And we will also have Dr. Katie Hawkins, who is the trainee representative for cellular pathology on the Trainees Advisory Committee of the college. So there are lots of people who you're going to hear from, and they'll introduce themselves, I'm sure, as they go through their talks. So I hope you enjoy this morning's session and gain something from it. I just want to give you a reminder to add some questions as you hear each of this morning's talks, and we'll pick those up at the end. And now I'm going to hand over to Jo Brinklow, who, as I mentioned, is the Director of Learning and oversees all of the learning activities at the college. So she is the person who knows all the answers to all of the questions. I'm going to hand over to Jo now, who's going to talk you through the role of the college, both in your training and a little bit more broadly. Thanks very much, Jo.
Thank you, Ronan, and good morning, everyone. You'll get lots of welcomes this morning, but I will add my own to it as well. Just going to quickly share my presentation. There we go. Okay. So I'm just going to give you a real broad overview of the college, both in respect of this next period of your training, but also a little bit wider, building on what you've already heard from our President, Bernie. So as Bernie has made clear, this is your college. We are here to help you through the next 5 years of your training, and there are many of my colleagues who will be here to support you through the rest of your career as well. There's a little picture in the bottom right hand corner there of our actual building in London. You'll be invited to come here, especially for our new fellow ceremony when you've passed your examinations, which are really lovely days, but there may well be opportunities for you to come and visit the college before that. Sometimes we hold our exams there, and there might be other events and things. You're very welcome. If you're in London, there is a members space, so if you need to pop in, do a few emails, very welcome to do that as well. So just in terms of the training period specifically, I've really just put together a few bullet points of all of the things that you can come to the college for during your training and that we can help you with. There are a large number of committees in the college. So the specialty advisory committees oversee the whole of the specialty. So there's one for cellular pathology. There are also committees that oversee paediatric pathology, neuropathology and forensic pathology as well. And there's also a cytopathology committee. But we also have a college specialty training committee, and as the name might suggest, that committee, which is chaired by Ed, who you'll be hearing from in a little while, really focuses in on all issues with regard to training, curricula and so on and so forth. We have trainee representatives on that committee, and we meet at least twice a year to discuss any relevant issues. The college is responsible for developing the curricula for your specialty, and also the assessment system that sits alongside it, which includes the RCPath examination, but also the workplace-based assessments, which we call SLEs now, and also the multi-source feedback. Sandra mentioned that she's responsible for the LEP system, which is the name for our ePortfolio. But alongside that, there is also ARCP guidance, which supports the curricula as well. As we've mentioned, you'll hear from Luke later about the pathology portal, so I won't talk about that, but it is a really useful online learning resource for you. And if you haven't had a look at it already, I would really urge you to register and start having a look at that. Some of the resources from the Part 2 examination are uploaded there once the examination has obviously passed, but there's a wide range of learning resources on there that will be able to support you throughout your training. The training team are on hand to provide advice and guidance throughout training. A little bit later, I'm going to talk about some of the other organisations that are involved in your training. And we do recognise that sometimes it can be really unclear about who is responsible for what in terms of which bit of your training and things. I always at this point encourage you, if you're unsure, use the college as your first point of contact. If we can't help you, we can generally tell you who you do need to speak to make sure that you've got all of the information that you need. And as Ronan mentioned, we will be responsible for recommending you for the award of the CCT at the end of your training. He made it sound quite threatening, didn't he? But, you know, we're fine. We're good about it. It's fine. The team also deal with the portfolio pathway process as well, which you may have heard about, which is a parallel route to the specialist register for doctors who aren't in a GMC approved training programme. There are some regional structures in the college, so there are regional councils for the devolved nations, and our training committee is made up of training programme directors throughout the whole of the UK. And they sometimes also then provide external input to deaneries, particularly for ARCP processes, for example. So turning then to what else the college does, and Bernie gave some guidance on that as well. I'm not going to go through this list in detail, but it was really just to try and emphasise the broad range of activity that the college is involved in. That starts from prior to training, we have a range of activities, competitions and things, webinars that we promote to undergraduates, both in medicine and science, and also foundation doctors, really to try and outline the attractions of the various pathology specialties as a career. We also provide support for international medical graduates who might want to come and undertake a period of training in the UK. And we've undertaken a number of successful international projects as well, with partners primarily based in Middle East and North Africa or Sub-Saharan Africa, in various pathology specialties. One of the big focuses of the college at the moment is around workforce. You might have heard that the government is looking at a 10-year plan, 10-year workforce plan. There's also the medical training review that is due out from NHS England. And the college gets involved in all of these, commenting on drafts, and advocating for the specialty and making sure that the specialty is visible to those that are making decisions in government and similar organisations. One of the big focuses at the moment is really gathering as much workforce data as we can about our specialties in order to allow us to make informed arguments about what's required for our pathology specialties and for our members. There's lots of other things there as well. You can see CPD portfolio, the guidelines and data sets that Bernie mentioned, and all sorts of things. So have a look on the website. There's lots of information on the website about all of these things. So if you have a spare moment, do just have a look around. This is a screen grab from the homepage from a couple of weeks ago. Again, really just to emphasise the breadth of activity that the college takes part in. And you can see on the left-hand side the second workforce census spotlight, which is on morale and wellbeing. I believe the next one that's coming out is about training. So again, when that does come out, do take a look at that. But these are the parts of the output of the workforce data that's being collected that is used to make the case for pathology and pathologists. So turning to the other organisations that we work with, this is quite a neat illustration that shows that the college works across the breadth of organisations involved in the delivery of postgraduate medical training. I suppose the most important one for us is the General Medical Council. They are our regulator. We cannot publish changes to our curricula, our assessments or our examinations without prior approval from the GMC, and we work to their standards. We also work closely with postgraduate deaneries, who you must have been in contact with already. They will issue you with your national training number. They will organise your ARCP dates for you, and you probably will have as much contact with them as probably with with the college, if not more. And then we have the local education providers, so the trusts and hospitals on the ground that are delivering the training day to day. So I mentioned that we work to the standards of the GMC. These documents are all available on the GMC website, and I think we linked to them as well from ours. Excellence by design is the standards that we must meet in order to be able to publish an approved curriculum. And this sits alongside the generic professional capabilities framework, which was introduced a few years ago for all colleges, and all postgraduate medical curricula must integrate the GPCs into their curriculum. So if you've looked at the histopathology curriculum already, you will see the GPCs threaded throughout the whole curriculum. And then we have the Promoting Excellence document as well, which the deaneries have to meet. So the college sets the standards for training, and the deaneries are responsible for delivering that training. And so there's another set of standards for them. Just to note as well about the National Training Survey, you probably have completed these before, maybe as a foundation trainee, but this comes out annually from the GMC. We work with them and we'll sometimes have questions in there about things that we would like to know as well. But just a reminder that this comes around annually. It'd be really helpful if you could complete it when it does come around, because we do look at some of that information that comes out of it, and that does help us, as well as obviously the GMC and the data and the information that they then provide, having looked broadly across all of the medical specialties as well. Just going back to the deaneries, obviously there are the SEBs, which is NHS England currently, NES, NHS Education for Scotland, the Welsh Deanery, and also Northern Ireland. You may know as well that NHS England is being devolved back into the Department of Health and Social Care next October 2026. I think we don't yet have full information about how that might work, but just to have that on your radar if you didn't already. And just on the bottom right hand side here again, just some really try and clarify the role of the deaneries, the types of things that you can go to them for. But as I've already said, anything you're unsure about, come to the college and we'll direct you or help you if we can. Also, just a mention of the Gold Guide. This is maintained by COPMed, which is the Conference of Postgraduate Medical Education Deans. And it's a really helpful document that it sets out the arrangements agreed by the 4 UK health departments, both for foundation and specialty training. It really is quite a helpful starting point if you've got questions or anything you're uncertain about. For example, how ARCPs work, there's lots of information in there. If you want to go out of programme, there are various rules and bits of guidance around quite a lot of things during postgraduate training, and this is a really useful starting point. So please bear it in mind. It's easily findable. Again, we link to it from our own website, but Google it and you'll find it really easily. So please make a note to have a look through that, or keep it in the back of your mind for whenever you might need it. You'll be hearing from Ed shortly about the curricula. You can see we've got the histopathology curriculum there, but also neuropathology, forensic pathology and paediatric pathology, which you can choose to apply for later on in your histopathology training if you would like to. These were all implemented in 2021 to the standards that I've already mentioned by the GMC and integrating the generic professional capabilities. We are currently reviewing those curricula. That began in June this year. And we think it's probably going to take at least a year for us to conduct that review. And a group has been put together to do that, including our trainee representatives. At the moment, there's not really any detail that we can share, but just to reassure you that there will be opportunities for feedback during this review from all stakeholders. So you may hear something about that in the coming months. But for the time being, the 2021 curriculum is the one that you will be following. Also, just a word about accelerated training. These are some updated guidance documents that we produced last year that sit alongside the curriculum and really provide guidance for you if you would like to have periods of training that you've undertaken either prior to your programme, or if you want to go out of programme during training, and on the odd occasion as well, for trainees who are really marching through the programme really quickly, completing things perhaps a little faster than the standard time. There is a process as well where we can recognise some accelerated time. Those are all on the website. So again, just bear that in mind if any of these either apply now or may apply in the future. There is guidance from us about all of that. Also, just a quick shout out for the Totem Pro card, which you can buy. We have an arrangement set up with Totem Pro to allow you to buy those cards. They're really good in terms of offering a range of discounts for all different retailers. I think it offers discounts on train fares and all sorts of things. So again, you'll find information about that on our website, but just to mention that for you as another benefit of registering with us at the college. So finally, having done a very quick overview of all of those things, just some contact details for you. So you can use our all of our generic training inboxes to contact us. So for training, anything about registering with us, any questions about the curriculum, the syllabus, the ARCPs as you come up to those next spring, CCT when you get there, and the sorts of training advice that I've just mentioned around potential acceleration or recognising out of programme, please contact the training team. The assessment team can be contacted for anything to do with the LEP system and workplace-based assessments. Pathology portal team, obviously Pathology portal, and same for exams. Obviously, when you're coming up to sitting your part 1 and part 2 exams, then please contact the team and they will be able to help you. But there is a huge range of information and advice already on the college website, so do use that as a starting point as well, because there's a lot there for you to have a look at. So that's everything from me, and so I will stop sharing my screen, and I think our next speaker is Dr. Ed Cheesman, who's a consultant paediatric pathologist based in Manchester. That's right, isn't it, Ed? So he's going to take you through more detail about the curriculum. Thanks very much, Ed.
Thanks, Jo. And I'm having problems with my presentation skills, so Louis is very kindly going to share my presentation. Thanks, Louis. So just while that's loading, good morning, everybody. As Jo said, I'm Ed Cheesman. I'm a paediatric pathologist by day. I chair the Cellular Pathology Specialty Training Committee at the college, and I'm head of School of Pathology in the Northwest. So again, another welcome from me, and also congratulations to your appointment to the Histopathology training program. Louis, next slide. So briefly, this is very much an overview of the 2021 histopathology curriculum, and we'll also touch on the syllabus document. And we'll talk about the assessment strategy for the program, which includes examinations and workplace-based assessments. Like I said, we'll touch on the syllabus requirements, predominantly that's associated with your first 2.5 years of training. We'll talk briefly about independent reporting, and ultimately, I guess the reason that we're all here is to see your progression through to consultant level. Next slide. So we've already heard from Bernie and Joe and Ronan. The college, very broadly speaking, promotes excellence in pathology across all of the pathology specialties. Specifically related to training, the college maintains standards through the curricula, training, assessments, exams, and professional development. And as Joe again has already said, while the college advises on the curriculum, it's ultimately regulated by the General Medical Council. Next slide. So the histopathology curriculum, and you'll have plenty of time to work your way through that. It's a competency-based curriculum, which ensures that there is progressive development of knowledge, skills, and professional behaviors. And you'll see there is a lot of emphasis now on professional behaviors. As we've heard, the curriculum is mapped to the GMC's Generic Professional Capabilities Framework, and we'll have a little look at that in a bit. And the curriculum sets the standards that are required in order for you to achieve your CCT in whichever histopathology specialty you choose. Next slide. This is just a screenshot of the website where you can access all of the curricula. So certainly you need to be looking at the Histopathology 2021 curriculum. That is what you would be working towards. But I'd also encourage you to take the opportunity to have a look at the other specialty curricula, neuropathology, pediatric and perinatal pathology, and forensic pathology. And if any of that is of interest to you, any of those specialties, then you should speak to your educational supervisors and TPDs early on in your training if you are thinking of going down one of those routes. Next slide. So very briefly, the training pathway for you is that you'll spend your first 2.5 years in integrated cellular pathology training, or ICPT. And this will give you a very broad exposure to all of histopathology, including autopsy practice, cytology, molecular pathology, now digital pathology. And as part of that, you'll be expected to pass the Part 1 and Part 2 exams. Following completion of ICPT, you'll move either into higher histopathology training, or you will move into one of the other fields, which we just mentioned, if you decide to do that. And if you go on into higher histopathology training, you have the option of including higher certificates in either autopsy and or cervical cytology. And again, that is a decision that you need to start thinking about towards the end of ICPT, so that the additional training time can be worked into your training program. And ultimately, the plan would be for you to pass the Part 2 exam. And if you get through all of that, then you will obtain your CCT in histopathology or other specialty. Next slide. This is just a diagrammatic version of the various pathways. You will all start off in ICPT, where you will spend 2.5 years. At that point, through a competitive process, you could interview for forensic, pediatric, or neuropathology, or you can continue directly into histopathology higher specialty training with or without the special modules. The autopsy and cervical cytology modules each give you an additional 3 months of training time. But ideally, this should be worked into your overall training time rather than being tagged on necessarily at the end. So that's why it's important to take that decision as early as you can. Next slide. So what is expected of you during ICPT? At the very beginning, you'll be, and this is probably what you started doing already, you'll be learning what normal histology is. And it's only once you know what normal is that you can appreciate what is abnormal. You'll learn about the safety and function of the laboratory and the dissection, room. You'll learn to assess, describe, dissect specimens. You'll learn about safety and function of the mortuary and post-mortem room, to eviscerate and undertake an autopsy. And probably most importantly, you'll learn to apply the knowledge you have in order to write a useful report, either to a clinician or to a coroner, and you'll come up with a clinico-pathological correlation which puts the whole story together. Ideally, you'll have some exposure to pediatric and perinatal pathology and diagnostic neuropathology. Forensic pathology you might come across very superficially. Not everybody necessarily goes and spends time in a forensic pathology service. And then you're expected to complete your work-based assessments, your multi-source feedback, and pass the Part 1 exam, which is one of the requirements of completing ICPT. Next slide. We've already heard about the GMC's generic professional capabilities and good medical practice. These were developed by the GMC and the Medical Royal Colleges, and these define career-long professional value. So it's not just while you're a trainee. This is a career-long framework, and it governs our behaviors, knowledge, and skills. It provides a regulatory response to any concerns that are raised, and again, this is relevant across all stages of training and future practice. There are 9 domains, and they're in that little diagram, and you'll see them within the curriculum. 9 domains within the GPC, and these are embedded throughout the syllabus and curriculum and the assessments as well. A good medical practice is central to the framework, articulated as achievable educational outcomes to guide training and assessment. And the purpose of all of this is to ensure that you are safe clinicians and that any concerns are picked up early on. Next slide. So you will hear about the capabilities in practice, and these are listed in the curriculum. Capabilities in practice describe the professional tasks that you must be able to safely and independently perform by the end of your training. There are 11 SIPs. 7 of them are generic to all medical specialties, and 4 of them are specific to histopathology. So we'll just run through these very briefly. Next slide, please, Louis. So we'll look first at the generic SIPs, which apply to all medical specialties. And this is kind of obvious information, but it's written down for you so that you have a sort of a framework to work towards. The first is that you should be able to function effectively within a healthcare organization and deliver consistent, high-quality patient care. You should be able to work within ethical and legal frameworks across all aspects of your clinical practice. You should be able to communicate effectively and able to take part in decision-making for patient care. Maintaining patient safety is always at the forefront of what we do, and you should be able to use quality improvement activity to improve things further. Next slide. These are the last 3 generic SIPs. You should be able to contribute and support and support research. You should behave as an educator, and we all do that as part of our roles within the NHS. And you should continue to self-appraise yourself, and we do this through CPD appraisal portfolios. And again, that is something that you will do throughout your career. Next slide. These are the SIPs that are specific to histopathology, and these are very broad. There's only 4 of them, which covers all of the specialties, so they really are very broad. But the first is that you should be able to demonstrate leadership and management within the laboratory. You should be able to use the laboratory and other services in the investigation, diagnosis, and management of patients and the deceased. You should be able to contribute effectively to the multidisciplinary team. And you should be able to manage and interpret pathological specimens accurately and safely. And probably that describes almost everything that you'll be doing through your career's interpretation of pathology. Next slide. So the SIPs are really very, very broad. So this is just an example of how the SIPs can be further broken down so that you can understand what actually is required of you to meet each one of them. So this is one of the histopathology specific SIPs. And you'll find this within the curriculum. There's a group of descriptors which just better defines that particular SIP. It just gives you a little bit more meat, I guess, to work with. This table also tells you which generic professional capabilities the SIPs can be linked to, and usually they're associated with multiple of the domains. And then finally, this table tells you what sort of evidence you can provide to show that you have achieved the SIP. And that will range from workplace-based assessments, logbooks, portfolio, passing an exam, multi-source feedback, whatever. It's quite variable. Next slide. You'll come across the term entrustment levels, and you might have already come across this in your foundation training. But essentially, entrustment describes the level of supervision that you need in order to perform a task. A level 1 means that you are observing only, so you're not even doing the task. And this is where you will be starting off in a lot of aspects of your histopathology training, is that you are observing because you're still very much at the learning stage. Level 2 means that you can act, but with direct supervision. So there is always somebody there who can come and help you. They may not be standing there watching you, but they are easily available to come and support you if you need it. Level 3 means that you can perform a task with indirect supervision. So perhaps a consultant is available via the telephone, for example. So they're not directly available. And level 4 finally means that you can perform a task unsupervised. And ultimately, that's where you want to be with all of your tasks within the curriculum. And that's what we're working towards. Next slide. So the assessment of your training includes multiple facets, including examinations, which you'll hear more about later. That includes various types of workplace-based assessments, and then supervisor judgments via assessments of practice and multi-source feedback. And the assessment provides evidence of your progress. It gives you feedback for your own development, and it informs your supervisors as to whether you are ready ultimately to function as an independent consultant. Next slide. Just to say, you might have come across Miller's pyramid. The college's assessment framework aligns with this model, and it's essentially that you work from obtaining knowledge, starting with a baseline of building on your knowledge, eventually to understanding, competence, and then performance. And the part 1, part 2 exam very roughly equate to where you are on this pyramid, but it's most of the assessment is aligned to this model. Next slide. Purpose of assessment is fairly obvious, but it's to provide you with constructive feedback and to guide your development. And particularly with the workplace-based assessments, you can get almost live feedback on how you're doing. They demonstrate your achievement of the required standards through formal testing. So that will be the part 1 and part 2 exams, and ultimately confirm or inform rather whether you are safe to be an independent consultant. Next slide. The workplace-based assessments, and we'll briefly mention what they are, evaluate your skills and behaviors in real working environments and in real time. They have very high validity because they are based on day-to-day clinical practice. And again, they support feedback and reflective learning. Next slide. The supervised learning events, these are your workplace-based assessments. So you have your case-based discussions, which evaluates your decision-making and application of your knowledge. The DOPS, or the direct observation of practical skills, assess your competence in procedures. So usually these are physical tasks that are observed. Evaluation of clinical events assesses your contribution to more complex tasks and teamwork. We'll just talk a little bit more about multi-source feedback and AOPs. So next slide. Multi-source feedback, you will know, is feedback that is collected from colleagues across the team. So this will be consultants, senior trainees that you're working with, laboratory staff, admin staff, mortuary staff. And it evaluates your professional behavior, your communication, team working, etc. And this gives your supervisors insight into practice that may not be observed on a daily basis within the laboratory. For most of you, I think the multi-source feedback is, I think it's year 1, 3, and 5, but check the curriculum. Others of you might find that within your local deanery, this is slightly different. For example, in the Northwest, we have a multi-source feedback every year because supervisors find it very helpful in terms of assessment at the ARCP. Next slide. Assessment of performance is another one of the documents that you need to complete as part of your workplace-based assessments. This is a more formal document where the supervisor provides a formal evaluation, usually at the end of a placement or rotation. And the report summarizes your progress, your strength, and recommends some areas for development. And again, this informs your readiness for ultimately independent practice. Next slide. I'm not going to go into any detail on exams because you'll have a talk on that next from Shafiq. But essentially, the Part 1 exam is about your knowledge, and you need to pass the Part 1 exam to go into higher specialty training or into pediatrics, neuropathology, or forensic pathology. Next slide. The Part 2 exam is about safely applying knowledge, and again, informs readiness for consultant practice. It's not the only requirement to be signed off for independent practice, but it certainly forms part of that evidence that is required for final sign-off at ARCP. Next slide. Just very briefly, you will have been through ARCP processes, so we don't need to dwell on this. But just to note, within histopathology, your evidence needs to be submitted on the ePortfolio, which you're going to hear about. Your supervisors will review all of your workplace-based assessments, exam results, multi-source feedback, etc. And it's the ARCP panel as a group who take the decision on how you progress through your training. It's not up to any single individual. Next slide. Briefly now, you'll see when you look at the histopathology curriculum, there is a curriculum document and there is a separate syllabus document. The syllabus goes into more detail about the specific knowledge and skills that are required of you at each stage of your training, and it's designed to be flexible so that it can be updated as things change and develop within our specialty. Next slide. So just very briefly, the syllabus overview for ICPT, which is most relevant to you at this stage of your training. It's for you to have a deeper understanding of your undergraduate medical pathology and the pathological basis of disease. Of course, it's about the macroscopic and microscopic assessment of specimens, the autopsy process, the very important, the significance of a good clinical history in putting together your findings into a clinico-pathological correlation. There is going to be quite a bit about digital pathology and certainly molecular pathology, production of reports, and this is not just how you write your reports, but also the technical and IT aspects of that within the various departments in which you work, the organization, management, and accreditation of laboratories, generic skills related to health and safety and legal and ethical frameworks, and the principles of working within the smaller cellular pathology specialties. Next slide. This is very important. The curriculum is competency-based, and there are no absolute minimum numbers of things that you have to do, i.e. surgical cases or autopsies. But it is anticipated that most trainees will achieve the indicative minimal practical experience detailed here, and you'll see this within the syllabus document. So it is recommended that within year 1 of training, you see at least 500 surgical cases, 150 cervical cytology cases, and 150 non-cervical cytology cases. And so just to emphasize, these are indicative numbers, and I always encourage trainees to look at these as a minimum and not as a target. So if you want to do well and fly through your training and do well in your exams, then you need to be seeing and doing as much as possible. So I wouldn't set this as my target. I would set this as my minimum. And then for year 2, it goes up to 750 surgical cases and 200 for gynae and non-gynae cytology. Next slide. So how do you learn everything that you need to know? The most important thing that you can do is your routine work. That is where you will be learning how to be a histopathologist. And I think we can't emphasize this enough, especially in the run-up to exams and the Part 2 exam. Trainees are thinking, how do I get through this exam? Probably the best and most important thing you can do is as much routine work as you can. Of course, you're going to need to go into the textbooks. There are online resources, private study opportunities, black box sessions. There will be regional teaching courses that you can attend, national training courses. You may have some particular area of interest, so you might attend some scientific meetings. You will learn a lot from your colleagues in the laboratory, biomedical scientists, and you will learn a lot from colleagues in other specialties at the MDT. So I encourage you to attend those whenever you can. Next slide. You might have attachments to other departments who have specialist areas of ophthalmic or liver that perhaps you don't get in your home trust. There are plenty of e-learning opportunities, but particularly within the college and the portal. You will learn with your colleagues by showing each other cases, asking each other for opinions, and then formal study. There are various different ways in which you will learn all of the things that you need to know. Next slide. I'll just go through these briefly. The core knowledge that is required of you is to understand anatomy, pathology, and disease. You must acquire skills in microscopy, obviously, diagnostic reasoning, and clinical correlation, and those are really important. And you must be able to write clear and accurate reports that your users can interpret and will find helpful. Next slide. You need to learn to safely handle specimens, describe them accurately, take the right blocks so that you can answer the question that the clinician needs answered. And you must understand how the laboratory functions and health and safety within the laboratory. Next slide. Reporting, we've talked about this. You need to know obviously how to use a microscope, recognize normal histology, and ultimately put together a clinico-pathological correlation and provide useful information to your user. Next slide. You will learn about special techniques. You will be this predominantly will be immunohistochemistry, special stains, but more and more you will see molecular pathology being used routinely now. So you need to have an understanding of those special techniques. Next slide. Autopsy practice, you'll be expected to have an indicative number of 20 autopsies in your first years of training. You should be able to demonstrate safe evisceration and dissection of the organs, and you need to be able to correlate your findings with the clinical information that you've been provided to come up with a cause of death. Next slide. So for cytology, you will, in your first years, be expected to do cervical cytology and non-cervical cytology, and you should be able to recognize and report benign and malignant cytological specimens. Next slide. We've talked about molecular pathology. This is becoming so integrated into what we do, so I would encourage you to make sure you have a good refresher of what you learned at medical school and go back to those techniques of DNA and RNA assessment, so that you have a good understanding of what testing you are doing on your specimens. And you need to be able to understand, interpret, and integrate the results into your histopathology report. Next slide. I'm just mentioning the specialties here: pediatric and perinatal pathology, diagnostic neuropathology, forensic pathology. If you can, try to get exposure in these. It is expected that you will get exposure certainly in pediatric and perinatal pathology and hopefully neuropathology. Forensic pathology, not necessarily, unless you have a specific interest. But you do need to have a general understanding of these specialties. There again are many resources on the portal and online for you to get some understanding of these specialties if you don't have them available within your own department. I appreciate trainees are finding it difficult sometimes to gain exposure, but please talk to your educational supervisors and TPDs and see how you can get the opportunities that you need. Next slide. I've only got a couple of minutes left, so I'll just mention briefly independent reporting. This is something that will come probably in your second year of training. It prepares you for consultant practice. We don't want to be in a situation where you get your CCT and then you're doing your first independent report once you're a consultant. You need to be progressively independently reporting from ST2 onwards usually. You need to have a logbook of cases that you've reported independently. And this is very much progressive. You'll start off with simple specimens. Next slide, Louis. And work your way up to more complex. So in year 2, things like gallbladders, appendices, and then working up to benign skin conditions, GI tract biopsies, gynae biopsies, and then ultimately more complex specimens and malignant specimens. Next slide. So the process of this will be different in each deanery and potentially in each department. But a proportion of your cases need to be audited. Any errors need to be categorized as none, minor, or major, and these audit results can form part of your portfolio for your ARCP. Next slide. You might find that there are some errors, and you might need some concentrated training on particular specimen types. You might need some extra supervision, and it might be that some specimens you're fine with, others you struggle with, and that is just very normal. Coming back from extended breaks, sickness, maternity, you might need to relog some cases and have these audited again. Next slide. Just to emphasize here, you can only report independently once the competence has been signed off. There should be no pressure to report cases before you are ready to report them, and the trial process should be transparent and supportive. Next slide. This is my last slide. In summary, The curriculum is competency-based and it builds progressively towards independence. The assessment combines workplace-based assessment, exams, and supervisor judgment. Independent reporting develops gradually with clear governance and audit, and ultimately this is to see you through to safe, independent consultant practice. Next slide. Like we've mentioned, you need to continue to reflect, learn, and adapt throughout your training, and you will continue to do this into your consultant career. So it's a good thing to learn now and to continue that through your training and career, because appraisal will be there forever. I think that's my last slide, Louis. There we go. Thank you.
Thank you so much, Ed, for taking us through the curriculum and all of the information there. That's really helpful. Can I remind you all, if you have questions, please keep putting them in the Q&A, and we'll come to those at the end and make sure we answer those. We are going to have a comfort break after this next talk for about 10 minutes to give us all a chance to go and get a cup of tea or coffee. But before that, I'm really pleased to be able to introduce Dr. Shafiq Gill, who has the dubious honour of being the panel chair for the RCPath exam in histopathology. He's a consultant histopathologist based in Nottingham. So over to you, Shafiq. Thank you.
Thanks, Jo, for a kind introduction. Good morning, everyone. I'm Shafiq. I plan to do this talk jointly with Dr. Mariam Khan, who is the Part 1 lead. Unfortunately, she had to attend a training course, so I will have to do the double act here. So Ed has really done me a great favor in terms of providing the right background about the curriculum and also the way the training works, and then leading all the way up to assessments. So hopefully I should be able to build on that, focusing on how the assessments or examinations, primarily within the assessment examinations, work. So when it comes to histopathology examinations, we think, as Ed rightly described, after ICPT or integrated cellular pathology training, candidates have the option to branch off to either carry on with histopathology for another 2.5 years, or choose one of the other subspecialties like diagnostic neuropathology, pediatric and perinatal pathology, or forensic histopathology, which have their own Part 2 exams. So as I rightly mentioned, so exams is one of the ways through which trainees are assessed. There are multiple checkpoints in the training progression which are mapped to the curriculum, and it's like an ongoing assessment system, and then also the exams fit in nicely within that. So we have broadly 2 parts to the exam. Part 1, which leads to what we call the diplomate status. It's a post-nominal, is optional. Part 2, which is more like the final exam, it leads to the award of an FRCPath qualification, and it is one of the requirements for CCT. Although it does not signal end of the training, there is still some training to be had after that, just to finish off and make sure trainees are ready for independent practice. There are other options other than the regular training pathway to get a specialist registration. So that could be through published work, or that could be through a certificate of eligibility of specialist registration, or portfolio based. So exams is just one way, but there are other options as well. Again, I think as Ed nicely covered, so there are multiple assessment tools, and they keep on happening at frequent intervals during the training. There are a number of workplace-based assessments, which are broadly form part of the supervised learning events, which Ed has covered. There is ongoing assessment of performance, and then trainees are expected to collect multi-source feedback, which gives them an understanding of how they are progressing in their training. And examinations are more of what we call assessments in point of time, just to get an idea. The trainees have gained the competencies as mapped in the curriculum. So broadly, as general sort of basic details, overall the exam is mapped against curriculum. So it tries to assess at that point in time that has the trainee achieved those competencies. For both exams, there are 4 attempts, and college does consider what we call reasonable adjustments if individuals have any special needs or any situations. Then there is an element of reasonable adjustments to make sure those can be taken into consideration. Similarly, if there are any mitigating circumstances, they are also taken into consideration to make sure trainees get the best chance to demonstrate their competencies through this assessment process. A lot of effort and energy goes into developing the exam material, making sure they map to the curriculum, making sure it's the right level of assessment. But then there are also options if for whatever reason individuals who have gone through this process, they are not happy with anything or their experience has not been as expected, there is an appeals process in place where they can appeal for their exam material to be reviewed against the standards. There is also a complaint system. If someone is not happy, there is a feeling they have not been treated fairly in any component of the exam, they can complain against this process. Ultimately, whether it's the training, the curriculum, or the examinations, GMC as the overarching regulator sort of has to keep and provide an oversight that our curriculum, syllabus, the training processes, and our assessment systems as examinations are fit for purpose and they are managed in a fair, transparent process. So some details about the Part 1 examination. As I mentioned, it's taken during ICPT, or the first 2.5 years, basically after 1 to 2 years of training. It's common for all specialties, and individuals have the choice after Part 1 to then branch off to the other sort of subspecialties. It's primarily a test of knowledge and understanding appropriate for the stage of training. So there is an expectation that you have good understanding of normal histology, basic pathology, and also autopsy practices and basic sciences which help with the day-to-day diagnostic work, so like molecular pathology, immunohistochemistry type techniques, and others, or special stains. So there's an expectation that the candidate by that time has acquired a reasonable degree of working knowledge and the way it is applied to the practice of histopathology. The format of the exam is primarily multiple choice questions, about 125, so which includes a combination of single best answers as well as extended matching questions, and it's a combination of those two. There is an effort to cover all subspecialties, all like body sites, and also the different disease patterns, like if you're looking at benign versus malignant, and also including covering all the other techniques, like I mentioned, autopsy, molecular pathology, immunohistochemistry, special stains, etc. The marking system is quite structured in the way that it looks at how would a reasonable or normal candidate perform, taking into account the difficulty index for various questions and making sure that no one is unreasonably disadvantaged, so that it's how the majority of the candidates with that knowledge and understanding would perform, and it then looks at to make sure it's fair to everyone. In terms of the logistics, it's a completely online exam, so that means it can be taken anywhere in the world. It's held, the college usually hires like a specialist company which delivers this. Previously it used to be Test Reach, now it's Riser. And so what that means is candidates have to register with them beforehand, and then at the set time they can log in and they can take that exam online from wherever they are in the world in a secure environment. Moving on to Part 2, which is like the final exam. Basically, it's more of practical and face-to-face exam, or we can call it physical examination. So there is a combination of assessment of practical skills and also looking at the readiness of the candidate for independent practice. with the clear understanding that the people will still have some time after once they've gone through the exam to further refine their diagnostic skills. So it basically assesses the readiness, but it's not basically a sign off that they can start taking consultant post, but it's when they've completed the bit of training afterwards and achieved their certificate of CCT, then they can start applying for consultant post. It's delivered globally from UK as well as a number of overseas centers, which are spread over to multiple other countries, and we constantly keep on reviewing and looking at where we need to sort of further expand our centers. In terms of the format, it's run over 2 days, and there are 6 different components within the exam. So usually it's a Tuesday and a Wednesday. Tuesday morning could be a combination of frozen sections, long cases, and OSPs or macros, and then candidates are split into batches. So they will do either batch 1 in the morning and batch 2 in the evening, and that's like a full day. Wednesday morning is now short surgicals, where they're given short surgical slides, about 20 cases, and they have to write their reports just the way you will do a normal reporting. And on day 1, there is also cytology, where they get 8 cases, and they have to just do the reporting again. It's a good mix of all body sites as well as the distribution between benign and malignant. So some of these components, like cytology and short surgicals, they are primarily what we call written components. But others, OSP1, frozen sections, and macros, are face-to-face components where candidates are given exam material, they make their own assessment, and then they are assessed by a pair of examiners. So there are pre-agreed marking schemes for these components, and all candidates are assessed against those schemes. And there is a committee or group of consultants who goes through, or senior examiners who goes through the pre-exam material selection to make sure it's good quality material, it assesses at the right level, and all candidates get to see the similar type of material. And then, as I mentioned, they're assessed by a pair of examiners who mark independently, but then they agree a consensus score. If there are any differences of opinion, then they can be marked by another pair of examiners, but generally that's more of an exception rather than a norm. Part 2 has a closed marking system, which effectively means that for every question, if you could, let's say, if there are up to maximum 5 marks, candidates can get between 1 and 4 marks. That's the range. And the reason for keeping it as a closed marking system is because the examination is assessing 2 bits. A, it's assessing the knowledge or the competence. B, it is also assessing the safety, that are candidates ready for safe practice. And then it prevents the possibility there where if someone has marked very well in few questions, marked very badly in a number of other questions, and they could still get through the exam. But with the closed marking system, then it makes sure that this does not happen. Candidates can show the right depth and breadth of knowledge across all the whole sort of exam components and the cases within each component, to make sure they've demonstrated they're competent and they are safe. And this is where this helps in that assessment. If candidates cannot make through the examination and they fail any component, then written feedback is provided to them to help them understand where were the sense of the deficiency, where were the deficient areas against the standards, and also this helps the candidates in terms of focusing on the right areas when they're preparing for their next attempt, to make sure they come back well prepared. And the feedback we have heard so far is candidates find it really useful because it helps them prepare well for the future exams. The exam is held, both part 1 and part 2 are held twice a year, so in autumn and in spring. So these are the 2 sort of exam sessions. Broadly, as expected, every exam brings a lot of stress with it, and candidates can be worried about, especially more about the part 2 exam, because there are elements where there is face-to-face components. But the way it's structured is it's not trying to catch anyone out. It's primarily to verify the level of competence individuals should have already reached through their training program. So it's just an assessment and validation of that. And candidates who have been through the structured training program should not normally have any major challenges in getting through the exam, because what it is assessing is more or less A, against the curriculum, B, against what is the expectation from someone who is independently reporting in the UK, is the expectation that how they can look at the material, they can understand it in the light of the clinical information provided, and formulate a report, and then also demonstrate what additional tests they will undertake to reach a diagnosis, and also how that report will be communicated to the clinicians, or is there any further work which needs to be done. So it's the reflection of the normal day-to-day histopathology practice as done in the UK. So I think the only bit of advice I can give you as lead examiner is to start preparing early. When you are reporting your day-to-day work, that anyway is your preparation for the exam. So getting an understanding of the way exam works, and then when you're doing your day-to-day work, reflecting a little bit on that how would it help me if it was an exam case, and what are the expectations from that, and that enriches your experience of reporting with the supervising consultants. So then you can focus on the right areas, and the quality of discussion will be good. The other bit, as Ed mentioned, was whilst there are minimum workloads standards of the number of cases one should have seen, as far as the exam is concerned, the more you see, the better you will be. So it's because in histopathology, on the one hand, we think there is a lot of repetition in our day-to-day work, but actually no two cases are exactly the same. And you always pick up something unique, something different about every case. So the more workload you have seen, whether it's through like direct reporting or it's through any teaching material, teaching sets, you can gain access to, it expands your horizon, and you would have seen more variations of the normal or of the pathology or disease, and more types of various diseases, and that gives you the right confidence, because in histopathology it's equally important that we know what it is, but also we are confident that what it is not, because the clinicians value both information when we can put it in our report. I'd mentioned independent reporting. There are Royal College guidelines. So from ST2 onwards, in a supervised, supportive environment, you should be able to gradually gain independence for easy to report, and gradually with so building on that. So whilst you should only do when you're ready to do it, but the way curriculum is structured, it really helps you gain those competencies. So from ST2 onwards, you should be really proactively looking for opportunities and engaging with your educational supervisor, with your training program director, looking at how you can start contributing to independent reporting safely in a structured way, but then with the gradual progression within that, because that would really prepare you well. So by the time you reach your exam, then the level of confidence you would have gained will be quite different. You will feel much more comfortable in making an assessment on those cases. Other considerations, I've just described the current format of the exam, but we know with technology there are changes happening very rapidly. So we constantly review the exam format, and both part 1 and part 2, looking at what's changing in the environment around us and how we need to make sure it reflects the current histopathology practice. So I would suggest that any changes are posted on the college website. So regularly visit the college website to see if there are any changes. Proposed major future changes, as histopathology is now transitioning towards digital pathology, which is one of the significant changes in the way we practice from microscope to digital. And more departments in the UK are now completely moving to digital pathology, and that means with time there is limited access to glass slides. So trainees also have to move to digital now. So this is one of the work streams, and we think we're starting planning work on this, is how we can look into as a possible option of a digital future exam. This obviously will have to, as Joe mentioned earlier, that any changes we make to the curriculum or to the exam, they have to go through the GMC approval, which takes a while. And we also are considering that maybe if we can create a pilot to start with, and then learn from that experience with then ultimate rollout, either again as side-by-side options or completely moving to digital. So it will be a lot of work, but it's just looking into how we can change with time. And other bit we constantly keep on looking is how we align with other Royal Colleges, how their examinations or assessment systems are changing, to make sure that we are broadly working on the similar themes. So in summary, basically FRCPath exams are an assessment to ensure future pathologists are well trained and ready to be independent, confident, and safe. And this is what the day-to-day, once you become a consultant, again, these criteria still stay with us for our entire life. So we have to then maintain our ongoing professional development through CPD, and as well as appraisals. Reflection is a significant component of that, to make sure that we maintain a safe and confident practice, because in the day-to-day clinical practice, the clinical teams rely very heavily on the histopathological opinion. Not only the diagnosis we provide, but the other information we provide in addition to the diagnosis, which helps with the either in terms of the prognosis or of disease or prediction of further treatment, or in undertaking additional tests, or even like for some other diseases, maybe extending to the screening for the family history. So exam is an assessment which then starts with that way of assessment, but then the practical life ultimately builds on that one as you go through the next stages of training, assessment, and then consultant life. So I think that thank you and best of luck with your training in histopathology. I wish you a great career in histopathology and a fulfilling and rewarding experience overall. Thank you.
Thank you so much, Shafiq. That was really helpful overview of the college exams. So as I said, it's time for a break now. Please go and grab yourself a drink and a snack. If you've got any questions, pop those into the Q&A as well. We'll be answering those at the end. If I can ask all speakers to put their cameras off and mute themselves during the break, but we will be back at 11:45 sharp, where we'll be hearing from Eva about the LEP system. Thanks very much, everyone. Hi everyone. We've just got about 30 seconds or so until Eva's going to start her LEPT presentation. So if you can get yourselves back and settled, and Eva will kick us off very, very shortly. Okay. So Eva is our ePortfolio officer at the college and knows everything there is to know about the LEP system. So Eva, I'm going to hand over to you. Thank you.
Thank you, Joanne. So as you heard, my name is Eva Takacs. I'm the ePortfolio officer, and together with my lovely manager, Sandra Dua, we're essentially the LEP team. So any queries you have, any questions, if you get stuck, just contact us via the assessment@rcpath.org email address, but I will talk later on about how to contact us and how to get help a bit more in detail. So welcome to the college from us, the LEP team as well. And I get straight to it. So where can you find the LEP system? So the LEP system is straight on the college homepage, so rcpath.org. And you will find the learning environment for pathology trainees linked here, which is short for LEPT. You will have received registration details from the training team when you registered as a trainee. And then you put in your email address that you registered with and the password, and you just click login. Now, before I do that, I show you how your screen will initially look like. So when you first log into the LEP system for the first time, you will get a screen like this. So you will need to have the information about who's going to be your educational supervisor and who's going to be your training program director at hand to essentially move into the LEP system. And this information you will get from your local deanery. And if they haven't given it to you yet, just contact them and they should have that information ready for you. So once you have this information, you log in to the system and it will take you to your ePortfolio. So initially, I will talk you through all of the elements of the ePortfolio and information that it contains. So your initial welcome screen ePortfolio is looking like this. You have the release button here at the top. This is where you set your professional relationships. So you will have already selected your educational supervisor and your TPD and any further relationships that are necessary for your annual review, your ARCP. You can enter through the release button. The alert screen is for us to be posting relevant and important information to any portfolio users. So if we have new information, for instance, here you can find information on the LEP drop-in sessions that we will be running from the 6th of October. So this is specifically for new trainees. So if you have any questions, you want a bit more of an in-depth walkthrough, etc., that's what these sessions will be for. We have really excellent, detailed and very short videos on various elements of the ePortfolio. Here are some instructions of how to download your training items. This is specifically relevant when you finished your training, etc. The ePortfolio homepage also contains your training card. This is particularly popular with trainees because it kind of gives you information at a glance of how you're getting on with your training year. You will be also able to change your relationships on this page. I will come to that later in a bit. And you have the traffic light system that tracks, so it gives you an indicative number of how many of these SLEs you have to have for the particular training year you're in, and then it will populate. I will show you this later as time goes on and you create your assessments. You have your taskbar here. The taskbar will list all of the unfinished items that you still have in your ePortfolio. So if you need to associate your SLEs with SIPs and GPCs, or if you have to kind of finish resource item that you entered and there is some more information needs adding, etc. So the system will remind you that there is still work to be done with various items. I'm going to talk you through the top bar here now. So the burger menu is quite helpful to take you back to your home screen if you have done an assessment, etc., and you want to get back to your home page. You just come here and click home. The profile section is useful to update your personal details. So this is where you can upload a photo if you wish. This is where you can enter your national training number, your professional registration number. This is where you can upload your CV. You can enter information on your job position and your workplace, and you just click edit and you can do that. You can't change your year of training yourself. This is something that us college admin have to do in the back end. This information that's contained in your profile will also be included in your workplace-based assessment, your ESSR, and your ARCP outcome form. The portfolio tab will be most relevant once you have completed your training, because this is where you can download everything that you have collected over your 5 years of training into one nice little zip file. This is the tab that you will probably be using the most frequently. This is how you enter your assessments. So I will circle back to that in a minute. And then once you have passed your FRCPath 1 and 2 exams, the information will be uploaded here via the college database. The ARCPs are essential. This is where you create your ARCP for the coming training year, and this is where your listed outcome forms will be as well for future reference. Training and development, these are activities that you can add to your ePortfolio. Any kind of training or audit or any management or teaching activity that you've done, you can enter here. And this is also information that will be included in your ESSR. Some trainees will be on training rotations at different hospitals and different places, you can create rotations here. This is also information that will be included in your ESSR. Just to say, ESSR stands for Educational Supervisor Structured Review. I will circle back to that one as well. And then you also have the option to include resources. This is where you would upload your logbook, where you keep track of how many dissections you've done, how many specimens you've worked with, etc. And this is also where because sometimes it takes us some time to upload the exams results, but you will get a letter if you passed ASAP. So you might have the letter, but the information has not been yet uploaded. This is where you can upload that letter to be again included in your ESSR. Yeah. And then this is the Help tab. So on the Help tab, you have information about various things that you might want to know about. This gives you information about the MSFs. Here are the instructional videos that I mentioned earlier. And how many assessments you need, etc. And this is also the tab where you can contact us directly. So if you click contact, it doesn't really matter. You can either leave feedback or report an issue. It makes no difference. It comes through to the same place. You can describe what your issue is, and then just click send, and it comes straight through to us. And you can find our contact number here as well. And if you ring this number, you will either come through to Sandra or myself, and we will always try and get to the phone, or I will ring you back if I miss the call. And our email address is here as well, so you can either choose to email us directly or fill in this form. Either way is fine. We will get this information. So I want to now go back to the home page and show you how to create an ARCP. So you go to ARCP create and list, and you just click create. Your ARCP date is also something that your deanery will share with you. You might not have this information yet, it's fine. Ideally, you want to put in a date that's about in a year in advance, so that it kind of gives you enough time to add items to the ARCP, and then you put in the period. So most of you will have started sometime in August, and then this goes on for a year, obviously. So you select the year as well. Actually, I will have to correct myself because your ARCP will most likely take place around the 10-mark time of your training. So in this situation, this would be sometime in June 2026. So I just select a random date, which you can do as well. And then once the deanery told you the actual date, you can always go back to change it, or you can ask us to do that for you. And then you just click save, and your ARCP has been created. So as you can see, this is the new ARCP. It says it's open, and there are 0 items assigned to it. And then when you go back to the home page, you can see that the information changed here slightly with the ARCP date, and you don't have any items added to this yet. Now, to create an assessment, you go to Assessments, Create and List, and I will just choose a random assessment to create, and a lovely Sandra will approve the assessment for us, and I'm choosing a case-based assessment and just create. And the system automatically will timestamp this. You might want to change it because your assessment was whatever a few weeks ago, so you can change the date. You can select the assessor's status. You can select what type of discussion this was. And then you can add the information here. I'm just typing something because, as you can see, these are mandatory fields. So everywhere where there is a little red asterisk is a mandatory field, and you have to enter something in there. And then you just click, you can either save as draft if you wanted to start it and then you want to circle back to it and it will appear on your taskbar, or if you finished it all in one go and you're happy with it, you submit to assessor. And then here is the assessment that we just sent off to Sandra. And it will tell you that the assessment is still waiting for approval. Sometimes we're all busy at work. Your colleagues will be very busy as well. So sometimes you might need to send them a reminder. So you can just click this remind button. It's a radio button. And then it will ask you to send to confirm that you want to send a reminder. I'm guessing it asked me because I only sent it off a minute ago. And then you have a little date stamp here so that you know, okay, I've emailed them now. I don't have to bother them for another week or two, and hopefully they will get the reminder. And then once the assessment, so I just want to quickly also show you that this will also appear on your taskbar, the assessment. I think it has already been approved because I can't see it. Let's have a look. No, not yet. So once the assessment, I have here an assessment that I can add to my ARCP. So this is an assessment that has already been approved. I have already assigned the SIPs and the GPCs to this. I will show you in a minute how to do that as well. And then you can add this to your ARCP. So you will have to add the assessments manually to your ARCP, but it's a relatively easy process. So just to say, there will be options and the 3 dots at the top. You click on ARCPs, and then you just select the open ARCP and click Assign. And then when you go back to your home page, here, a box has already populated. This is now green, and there is a hyperlink. So every time you want to check, okay, so what kind of case-based discussions I had already, to just keep track of what else you would need to consider, you can just click on the hyperlink and then go straight to this assessment. So Sandra, thank you very much, has now approved this assessment. So you want to associate the assessment with the SIPs and the GPCs. So you can either go through this little tab here, associate with SIPs and GPCs, or you can go into the assessment itself and then through options. So if you select any random SIP, it will automatically pre-populate the GPCs. So you can always deselect and select something else as a GPC, but the system is designed to kind of correspond with the SIPs selected. And then you just click Add. And then the same way, it takes you back to the assessment, and you get the assessment, the options again, and you select ARCPs. And as I said, you can add that to your portfolio. And then when you go back to the home page, it now contains 2 case-based discussions. then once you have at least one item added to your ARCP, I show you how to create an ESSR, which is an important part of your ARCP process. So you click progress. So as I said, so you at least have to have one item in here. You click progress, and then you will have this button here that says create ESSR. Now, just to show you this, I create an ESSR. Yes, I want to create an ESSR. Yes, I really, really want to create an ESSR. And then I click create ESSR. So the information that this will contain will be your educational supervisor, your own details. So as I said, this will be information that the system will get from your profile page. So the more information you put in there, the more information will be contained here. There will be elements in this form that are mandatory to complete, but they all contain a red asterisk. And then you have the option. So again, these are all things that you don't have to kind of finish in one sitting. You have the option to save elements by stages. It will contain all of your previous ARCPs, all of your previous placements. It will list all of your workplace-based assessments. I've mentioned logbooks, which I will show you very briefly how to upload on the resources. So here will be the list of logbook items, any audits you've done, any research project, publications, teaching activities, management development. I spoke about the training development tab. This is where you enter those presentations you've done, courses, anything else. And then these fields will not be editable for you because this is the bits that your educational supervisor will complete. And then, as I said, so you will have the option to just save it if you want to circle back to it and work a bit more on it, or you can submit and send to the educational supervisor. I forgot to mention how to change your relationships. So obviously you will have to have this information, and this is also again something the deanery will tell you. So you have the option to either click the release button, and this takes, I actually timed it with a stopwatch the other day, about 10.5 seconds to open, which is a great improvement because it used to be a lot longer. So I select Sandra as the head of school here. You will get a list of possible names because it has to be someone who has this attribute and who works in the deanery that you work in. And as you can see, this has now been populated with Sandra. And then you can either do this release button, or you can also just click in the hyperlink on the training card, and then you get the same window open up. I haven't actually timed this, but I'm guessing this will also be about 10.5 seconds. And then you can, so if you have an external representative who will be part of your review panel, you can add them here as well. Head of school, you can add them here, etc. And then you just click save, and the information changes immediately on the training card. Now, as I promised, I show you how to add a letter, for instance. So let's just say you've passed your RCPath 1 exam, and then you can add this here, 1, and then you select file because you will upload a file, and then I will just upload this document. First login. Oh, sorry, apologies. So you add this document, you can add a little description to it. You can associate it with SIPs and GPCs, or you can select not relevant and then add. And then this is the information that will then appear in your ESSR. And the same with the logbook as well. Now, MSF has already been mentioned earlier by, I think, Dr. Cheesman. So for year 1, it's going to be us who will initiate the MSF for you around February time, but you will be notified of that by the system and by myself. And from year 2, you can initiate your MSF yourself. And I think I have mentioned everything. I would like to mention our drop-in sessions again. So the first one will be 6th of October at 11 a.m. And it's a drop-in session, so you don't have to sign on. You just come along. The information is on the website. The information is here in the left ePortfolio as well. And if you have any questions or you want me to talk you through any of these elements in a slow and steady pace, just come along and we are here to help. Generally, again, I would like to stress that we are here to help. So Sandra and I are here to make this as easy for you to navigate as possible. If there is something that you can't add, you get to closer to your ARCP time and you can't add anything else to your ARCP because the ARCP date is coming up. Just contact us. Most of the things we can do for you. Some of the things we might need deanery permission for, or we would need to go to our developers to ask about. But 99% of the time we can help you with whatever query you have. Yeah, that's it. So if you have any questions, please just put into the Q&A box and I will answer them in a minute.
Thank you, Eva. That's really helpful. Quick but very helpful overview of the LEP system. Okay, next we have Dr. Katie Hawkins joining us. She is the Cellular Pathology representative on the Trainee Advisory Committee, and she's here to talk to you about that committee and what they do and what the trainee representatives do for the college. Over to you, Katie. Thank you.
Hello, can you hear me?
Yes, we can.
Fantastic. I'll try and share my screen. Try being the operative word. Hang on 2 seconds. It may well be that you can see the stuff at the side.
Can't see anything yet. That's it. Looks like it's sharing now.
Fantastic.
There you go. And if you could just
And
put
is
it in...
that now on full screen?
No, if you just put it in presenter mode.
Okay, hang on 2 seconds. Sorry about this, guys. So slideshow. I used to be really good at this, and then we switched to Teams.
We've all de-skilled since COVID, haven't we?
Yeah. Has that worked?
Yeah.
Brilliant. Okay, so thank you very much. My apologies for the technical issues. Thank you, Joanne, for introducing me. So, as you said, I'm Katie. I am your Trainee Advisory Committee Cellular Pathology representative, and I am currently a resident doctor in the East of England Training Programme. So first off, well done. You've made it. We're the best speciality, and it's been really competitive this year. So well done on getting your training places. It's a fantastic choice. Histopathology has a lot of different career paths available within it. So there's a niche for everybody. It's a really supportive and inclusive training program. The college is genuinely really welcoming and helpful, and they're really good to deal with. And it's really interesting. I mean, we were all told when we were starting to go to medical school, don't say that you want to be a doctor because you like people and you want to help people, and you like science. But in this job, you get to help people and you get to do all the science. So it's what a lot of us wanted to do. So fantastic. So I'm here to talk to you about the Training Advisory Committee. So what is it and who are we? So we are your links to the college. We are comprised of representatives from 17 different specialities, and you guys are doing histopathology. Histopathology is, I think it's the largest speciality within the college by quite a chunk. There's a lot of us. There's a lot of work to go around. And because of that, although technically I'm a cell path rep, we do also have a cytology rep. We're getting a dermatopathology rep. You guys have all started on a very broad training program at the moment, but in ST3, some of you guys might go, actually, I really find perinatal and pediatric pathology rewarding. I want to be a forensic pathologist. I want to be a neuropathologist. And it may well be that you kind of reapply to do that as a secondary program, but you're starting, and those guys all have pathology reps at the college, but it's all the same starting point. The TAC isn't just doctors. We also have dentists, we have vets, we have biomedical scientists, because the RCPath training the RCPath oversees the training of loads of different specialities, and they're all represented. What's also worth being aware of is that we've got representatives from the college itself. So Joanna Brinklow, our Director of Learning, who you've all met, is one of the TAC members, and we've got kind of Clinical Director of Examinations. And that's really helpful because, as we're saying, we're representing the trainees, but we're your link to the college. So it's really helpful that we've got the college involved there. So the role of the TAC, as we've said, it's to represent each of you. It's to put forward your concerns, your queries to the college. It might well be that you kind of say that there's something that you really like. Can they do more of it? But a lot of the time it's concerns and queries. We, as trainee reps, it's not just the TAC committee, it's the same, sorry, Trainee Advisory Committee itself. There's other areas that we get involved on. We're representing trainee views and to the college for lots of different things, and we are the trainee voice on multiple committees. And one of the things that we actually spend quite a bit of time doing is reviewing documents, curricula. We're here to provide the input of the pathologists of the future in various projects and go, actually, would this work for us? Is this going to have a negative impact on training? Is this something which sounds fantastic for the workforce, but actually it's going to kind of really impact on our experiences? And we're part of the role of the trainee rep is to kind of turn around and say, you know, remember this. Sometimes we will contact you to say there's a project going on at the college. Is this something that you would be interested in doing? Sometimes the data sets actually have trainee involvement in, which is a fantastic thing to put on your CV, and it's also a fantastic thing to get involved in. It's kind of an element of like research and management altogether. So we will kind of sometimes contact you guys saying like, does anybody want to volunteer? What I would say is that we're here to represent you guys. So yeah, talk to us. I'll tell you about how to communicate with us later. Something that is worth being aware of is that it may be that it's an issue that it isn't really something that the college kind of gets involved with or manages, but it may be that it is. We're all, you know, it may well be that we're able to point you in the right direction. And often it's, you know, even if it's something that's outside the college, it may be that it's something that we're able to help with. But you don't know unless you ask us. So the TAC meets 4 times a year. We've got 2 big meetings and we've got 2 little meetings. But we're in contact throughout. We've got a WhatsApp group. We kind of communicate by email. And there's always a dialogue going backwards and forwards. When there's issues arising that impact on trainees, then often this is something that is discussed. It's not always something that we can give a response to straight away, as sometimes we need to have a formal response from the college, but it's something that we look into. We're supported by the fabulous Louise Mayer, who's our information no, she's not information governance. I'm so used to putting that in front of it. She's our governance and committee service officer. And at these meetings, we have a report by each representative of what's going on within our speciality. And have I included a big? Yes, I have. I've included a big bit on the this next section, because before the trainee meetings, you guys are invited to submit questions, queries, things that you want us to be aware of, things that you want us to discuss about examinations and training. I'll talk about how that works in a second, but the impact of the TAC is really valued by the college. The college will quite often ask us for our impact or our input on various policies and kind of how we think that things will affect training. So communication with us, there's a kind of the more formal route and there's the less formal route. So formal communication, like I say, is that we have 2 main meetings a year, and before those main meetings we have the trainee inquiry form opening up. Now this is currently open, so you guys should have been emailed a link from the college to this online question portal, and if you have any questions that you want to be discussed, you can submit these here. This is the form, and you can see that the only kind of required information is your inquiring question and the date. Not quite sure why the date's super important, but you don't need to give us your name. You don't need to give us your email address. You don't need to give us your membership number. But if you do give us any of those things, then when it's being discussed, at the meeting, when it's included in the minutes, it will be anonymized. And all of the things that come in through here are minuted in the discussion and included on the TAC homepage. All of the inquiries that come through here are reviewed by the Director of Learning and Examinations, who come up with their initial responses, and then these responses are presented by the Director of Learning at the meeting for discussion with the TAC members, and then for a final response. And if you've submitted and given your details, you'll get a direct response. Otherwise, it'll be included in the minutes. So if you want to stay completely anonymous and don't want to give us your name, then that is something that you can still do and have it discussed at this high level. From a less formal, you can, I'm just going to shimmy this little box because I'm conscious that you probably can't see other bits very well, but we've got the TAC Advisory Committee general website. We've got lots of links, lots of information on there, and we've got a link to the to that formal question currently open. Our Twitter account is currently being looked after by Liam, who's doing a great job, and that's at Pathology House if you're interested. What's worth being aware of is that the trainees and the TAC are also quite involved with the RCPath bulletin. If there is information on this page about how you can submit kind of articles to the bulletin, it's not peer reviewed, but if it's something that you want to get involved with, you're very welcome to, and it does look good. This is the generic email, rcpathtac@gmail.com. And I'm also happy for you to email me, but I'm not going to say what it is on this presentation because I know this presentation will be up on the web page for quite a bit longer. But I'm going to be in this role, so but you can contact the college and they can pass it on to me and they can give you my email. So that's what the Trainee Advisory Committee does. You know, we are happy to be contacted. We are happy to try and sort stuff out. And I know that I have been contacted in between meetings by people, and we've done our best. But a lot of the time, people are there going like, actually, so that's a management role that you're doing within the college. What else can I do? What a lot of people are keen. You know, you're all keen beans. You wouldn't be here if you weren't. And a lot of people are keen to try and get involved in management. It may well be that this is something that you've always been interested in. It might be something where you're there going like, actually, this is something that I'm not interested in and I want to push myself. It might be that there's something that you want to change. And there are lots and lots of ways that you can get involved in the college and in other kind of areas. Trainee Advisory Committee, quite often, you'll get an email saying that like somebody's stepped down, somebody's come to the end of their tenure, and I would say that it is a really good thing to get involved in, and would strongly recommend that you do so. The Pathology Portal, you'll have heard about that, is an absolutely amazing resource, and I'm very jealous of you guys because it wasn't about when I was an ST1, so you're very lucky to have it from the outset, but the more that people contribute, the better it gets, and they are happy for people, you know, they are looking for trainees to get involved. There's a lot of public engagement that you can do, either within the college or through other means. And one of the big things that's coming up is the National Pathology Week. So 3rd to the 9th of November, if you go on the RCPath website, there's kind of information about things that you can do if you've got a lot of time and if you've not got a lot of time. But again, this is something where we love cellular pathology, we love what we're doing, and we know why it's important and the massive impact that it has on the patients. And we want other people to be aware of what we're doing and why it's important. And there's lots of other opportunities as well. There's a lot of other, like you can do things on a more local level within the deanery. You can do things, there'll be management opportunities and communication opportunities within your own hospitals. And there are other organisations that you can get involved with as well. What I would say is before you do get involved, things that you should consider is, have you got the time? All the TAC members are volunteers. This is something that we do on top of our normal workload. And I would say that if you contact me, then generally I'm a fairly quick responder to emails. So if I've not responded, please send it again, because it may well be that I've been having a particularly busy time period at work and it's gotten lost in my emails. It's not intentional, but it is worth considering. Have you got the time? Have you got the bandwidth? It's not just about how much time you've got, it's how much kind of energy you've got. It's what other exams are you doing at the time? And are you willing to learn? Which has been, I've clip-arped over, because you don't need to be a perfect trainee. You don't already need to know how to do management. Something I would say is that you don't already need to be a senior. I'd say it's worth settling in ST1 first. Like histopathology is a huge learning curve. It's fantastic, but it's not something that everyone will have done at medical school. And it might well be that you're kind of feel quite, you know, everybody's got different experiences. So you give yourself time to settle in, but a lot of the time you've got more time when you're a more junior trainee. So don't think that you have to have got this exam, you have to have got this far first. I'm just going to do a very quick thing about some tips because I'm conscious that I've only got a few minutes. I would say, this is not an RCPath thing, but I would say as new ST1s, check your deanery website. So your deanery coordinates the delivery of training, and there's different resources available depending on your deanery. The reason why I say check your deanery website is that you guys have all just moved, or you've just changed deaneries, you've just, it's a big transition time for you. And there's actually moving expenses that are available through most deaneries. There's travel and study budgets. This is done through your deanery website. You don't want to leave it too late because it might be that it has to be done within a time frame. Your deanery can also offer you study support, and there's also professional support networks available for if you need it, again, for study, for emotional support, for neurodiversity, things like that. So as ST1s, read, try and make sure that you get your fundamentals down. It's also worth trying to attend MDTs because you need to understand why you're doing it, how the report impacts the patients. It's worth having a chat with your BMSs, find out how the lab works, attend management meetings, consider getting involved with the RCPath. Again, this is your time when you're establishing your broad base of knowledge that you're going to build on later. I would say that if you're interested in doing any research, ST1's not a bad time to start. The RCPath has some funding opportunities, which I've included a link there. You will all have different pathways. Some of you will go on parental leave and take some time out. Some of you guys are going to do some PhDs. Some of you guys might say, actually, I'm going to go do neuropath. But some of you are going to go from ST1 through to ST5, hit all, do everything at the kind of prescribed time frame, and it goes really quickly. If you want to get involved in kind of research, I'd say that the earlier you start, the better, because you blink and then you're in ST5. Just going to mention, there's other professional organisations. They usually don't cost very much. There's usually bursaries, courses and webinars available through these guys, and often membership is considerably cheaper than a one-off webinar. You often need a sponsor to join. If there's no members within your department, or there's no consultants in your department who are members, if you contact the organisation themselves, they'll often sponsor you themselves. Exams, prepare early. Be aware it is expensive. And what I would say is consider if you may be an individual that has additional needs, in particular things like dyslexia, ADHD, autism, neurodiversity. Often you will need to be assessed through your deanery, professional support networks. Some deaneries will allow you to self-refer, other deaneries require it to be an educational supervisor referral. What I would say is that if you think this might be you, be aware that the college is really supportive. I think that the amount of trainees or the amount of candidates that have additional time is about 6% at the moment, but the process takes time. If you think that you might need additional support, try and do it before your exams. You don't want to be scrabbling around at the last minute. I'd say look after yourself. It's a small world. It's very different working in an office to working on the wards. The people who you're currently sitting next to are the people who will be your friends for a very long time. I'd say when you're reflecting using your LEPT, be aware that you can reflect on positive things as well. I've seen so many comments where people have they've been desperately trying to find something negative that they can criticize themselves on and say that they can improve on. Your reflection can be, I did this well. What I'm going to do in future is I'm going to make sure that I do a similar thing again because it was an example of good practice. These are, you can be positive. And if there's any problems, give us send us an email on the TAC as well. So congratulations. I hope that you enjoy your time in pathology, and thank you very much for listening. Have you got any questions?
Thank you, Katie. We're directing everyone to put their questions in the Q&A box. So if you can stay, we've got just one more short presentation, if you can stay, and I might come back to you. But thank you so much. Just to really reiterate what Katie said, this is not with the TAC, it's not sort of them and us. We're all on the same side. We've all got the best interests of pathology training at heart, and so we really do work together. A really practical example of that, the form that Katie showed you, where you can send your sort of questions and things into the college. We've actually pulled the information from the last 3 years or so about common questions that have come up around delivery of the histopathology curriculum, and we're actually using that. We've used it already to feed into the curriculum working group that's just started up. So it's that type of thing that we do. So and I will come back to some of the points that Katie made as well about neurodivergence. Sorry, I've seen that there's a question, but I'll come back and add to what Katie said there as well. So we've got one final presentation from Luke Thrower, who oversees the pathology portal. As you know, Luke hasn't been able to join us this morning, but he has prepared a presentation, which Louis is going to share for you now. Thank you, Louis.
The Pathology Portal is a catalogue on the NHS England digital learning platform, the Learning Hub, and is designed to enhance the learning experience for those in pathology or pathology-related roles, from undergraduates all the way up to those with years of experience, providing access to over 6,800 resources and more being added all the time from over 100 contributors. To date, the resources have been launched more than 350,000 times by just under 7,000 users, and has been recognised with awards from both the HSJ and Healthcare Honours, as well as our transfusion editors collecting an award for the work that they've produced on the portal. It was also included in a parliamentary response to a question around the work being done to address training around digital pathology. This is the homepage of the Learning Hub, where you can log in. Lots of emails are now able to self-serve and create their own account, including those with NHS, Gov, AC and doctors.org emails. For anyone else, they are welcome to contact us and we can support. You have the catalogues available, of which the Pathology Portal is the most accessed catalogue on the Learning Hub. These can be bookmarked for convenience. Here we have the folder structure for the Pathology Portal. You can see that all of the specialties are listed, and we have a really varied range of resources, but some specialties do have some more than others. We're communicating regularly with editors and engaging with the data to address gaps, find new ways to collaborate with the specialty, and promote the work going into resources. Inside the folders, there are subfolders which drill down to more specialist areas, and this is reflected in the other overarching specialties too. To support learners finding the right content for them in terms of level of understanding, lots of folders are also broken down into levels, with level 1 being the most basic up to level 5, which might be more specialist or rare content. One of the big positives of the portal is the whole slide imaging function, which allows high quality slides to be uploaded alongside case information, like in this image here. These images can be supported by annotations and labeling, directing the user towards particular areas of interest. These slides can be supported by extra information like videos. Here, one of our editors has provided a walkthrough video to accompany the slides, so learners can follow along with what's being discussed. The portal also has included a range of assessment tools, both formal and informal, allowing those teaching to add questions ranging from single best answer, pin an area on a map, match games, and multiple choice. These can be provided with feedback after every question or in an exam style whereby the user just receives a score at the end. We have built on the use of this whole slide imaging functionality, and it's led to us currently hosting several EQA schemes for skin, gynecology, urology, and the Northwest General EQA. From an access point of view, the feedback has been positive and allows for variation in delivery of EQAs. We share the hosting with other providers so the users have multiple options. In terms of them being uploaded, we've been able to work quite quickly to respond to requests, as the process of loading slides and processing is very easy. Having the EQAs digital helps to provide learning opportunities that wouldn't be available otherwise if they were physical slides, but we're also uploading the answers after they happen so that future users are still able to get a benefit. The portal includes resources like structured haematology tutorials. Our haematology editors hosted 4 morphology sessions aimed at ST3s, and they uploaded the cases to the portal beforehand and were able to use them on a Teams call to demonstrate and run the session. With trainees able to access the materials alongside those delivering the training, these training sessions were also recorded and uploaded both for the benefit of those in attendance and those delivering the training, but also for those who are interested in the content in the future. This provides a space for learning that trainees can access at their own pace, supporting self-study alongside led sessions. We have supported with editing recordings of Teams and Zoom calls, and currently we're receiving monthly lectures from the UK HCDO, and also have a couple of other contributors delivering short lectures on other specialties on a regular basis. Another example of this is where we've uploaded paediatric pathology slide seminars, encouraging those delivering teaching to use the portal as a host for slides and teaching sessions so that learners can view the slides simultaneously. We've also been supporting Professor Adrian Flanagan by uploading an incredibly large archive of soft tissue tumour content, working in collaboration with those in her team to add slides and educational content so that this knowledge doesn't become lost. Another exciting application of this has been in its reach in supporting international teaching, such as Richard Byers' program in sub-Saharan Africa. We've been able to upload his slides and lectures to support his work whilst he's there teaching, but retaining the value of that teaching so that others can access the opportunity afterwards. This provides a great opportunity for trainees to engage with diverse cases that they wouldn't have been able to get exposure to. Users are also able to use the search function to find specific content if there is a particular topic they're interested in. A single sign-on is available from the college website under the My RCPath drop-down, where the college account can be linked with the Learning Hub account to make access easier. Those who've integrated the pathology portal into their training have found it helpful in increasing engagement, and we're seeing regular spikes around periods like exams, these new trainee welcome days, but also following presentations at conferences or where we know the portal has been circulated at a meeting. These slides have been examples, and the team are always excited to hear how individuals might want to apply the tools. The support team here are happy to help talk through any of the things that you might want to do and to see how we can help. Whether that's helping to create structures for content, uploading or editing, or just being on the other end of an email or a call to advise. We're also supported by our editorial board and community of contributors, which allows us to seek out advice from others, share learning and developments with the portal, and improve the experience of use for all. If you'd be interested in contributing content, you can get in touch with us at pathologyportal@rcpath.org, and we can go from there. We have a QR code here if you have any feedback on the portal or the presentation, and if you would like to sign up to the portal, you can find all of the information on the Pathology Portal page on the college website. Thank you for your time.
Fantastic, that's great, and thank you to Luke for preparing that overview. Okay, so we have just about 15 minutes left now for any remaining questions. So if I could just invite the panel to switch their cameras back on. But I can see that everyone has been very busy bees in the background and has been providing answers to the very vast majority of questions that have been coming in. So if you've got a burning question, please put it in the question and answer box now. This is your chance to get it answered. I will kick off just with the question about implementing reasonable adjustments for the examinations, and I'll also ask Shafiq to come in and Katie as well on this one. The question is whether it has been possible for the college to implement disability-related reasonable adjustments like extended time for the Part 1 and the Part 2 examinations. So absolutely, this has been in place for quite some time now. Just to make you aware of a few things. As Katie said, in order to give yourself the best possible chance of performing well in an examination, if you do need to go through a process to get an educational psychologist report, for example, and get some recommendations about what would work best for you, both in the workplace but also in examinations, it is best to try and get that done as soon as you can, well in advance of taking your examinations. What I would say, though, just to reassure you, is that we've actually adjusted our regulations now in line with all of the other colleges who are asked to do so by the Academy of Medical Royal Colleges. So if you are going through your examinations and if you fail once or twice, and actually then if something comes up and you realise that actually you will need some adjustments, you get a subsequent recommendation from a relevant individual, you can bring that to the college and we will look at that, and we do have then the ability to actually remove previous attempts that you might have failed, so that you can kind of start over again, if you like, with your exam attempt. So although Katie's advice is absolutely right, and that is the first thing to do and the first thing to think of, just wanted to reassure everybody that there are other support. There is other support in place for you if you subsequently are diagnosed and need to start having adjustments. Just also to give you an idea of the types of adjustments, so the Part 1 exams are held online. It's very easy for us to extend the time for those examinations in line with recommendations that you send us. The new platform that we are using is actually really open for any candidate, so you can make the text bigger or smaller, you can put in your own colour overlays and all sorts of things like that. We don't have to set that up in advance for you. Before you take the exam, you'll get a chance to go in and practice on the site, so you can look at everything that's available for you and work out what's best for you before you actually sit the examination. So that's just some examples there. And also for Part 2, the team will work with you to work out a timetable that works best for you. We have been talking about disability, but there are other reasonable adjustments that we can make as well. So, for example, sometimes we have pregnant candidates who might need additional rest breaks. We've had candidates who are breastfeeding, and we've made arrangements for them to be able to take a break and breastfeed during the examination. So it's a wide range of reasonable adjustments, not just disability, but those are all included. So I don't know if Shafiq and Katie, if you wanted to add anything to that.
Yeah, happy to come in. Thanks, Joe. I think you've covered it quite comprehensively. So I think all I would say is obviously we assess each case individually based on their own needs, but by all means, if anyone feels that they have they need that additional support, I would encourage to get in touch with college as soon as possible before the exam, and then we do consider.
Thank you. I think you were just breaking up a bit there, Shafiq, but I think you were just encouraging everyone to contact us as well as soon as possible when they're coming up to exam time. Katie, is there anything else from you?
So I'm dyslexic, and I had extra time and use of a computer during my Part 2 exam and my Part 1. Part 1, you always have a computer, but I would say that the college is actually really helpful when it comes to kind of doing reasonable adjustments. It's got to be a reasonable adjustment, but what is considered reasonable, the college are actually really helpful with. And they've also, I've had a few colleagues who have been in the process of getting diagnoses when the deadlines happened, and the college have been more than flexible and more than reasonable, and have like no guarantees have ever been made, but they have gone out their way to try and help people. So I would say that it's not something that people judge you for as well within the training program, and it's not something that I would say to be resistant about trying to get help if you think you might need it. And it also might well be that you're there going like, oh, I'm fine because I've managed to get through medical school, I've managed to do this, I've managed to do that, I've managed to operate at a very high level for a long time. Sometimes this is a really, really high level, and it may well be that you need that little bit of extra support. So I would really encourage people to go for it. And yeah, the college has been great.
Thank you, Katie. Just one more thing to add from me. Obviously, Part 2 exams tend to be a lot longer than our Part 1 exams, but also what we have been doing is reviewing all of our Part 2 examinations, just with a view to really identifying what we really need, what are the key things that we need to examine at Part 2. And quite often when we've done that process, we've been able to reduce our examinations. Many of our Part 2 examinations are now down to 1 or 2 days. And the reason that I'm mentioning that and why that's important when you need reasonable adjustments is that obviously when you've got a 1 or 2 day examination and you need additional time for that, that really does make that particular examination very long for candidates with reasonable adjustments. So we're looking at all of those things as well, alongside the provision that we have in place when candidates ask us. So we just have one more question that's not been answered, which is around whether you're still required to complete the molecular pathology e-learning module. I don't actually know if that's still in the curriculum. I know it was in the previous curriculum. The only thing I would say, though, is that things have moved on so much. When that was in the previous curriculum, e-learning was like a really new thing. And now everybody just takes it for granted. And obviously we've got the pathology portal, and I'm sure that there will be huge amounts of content on there. I will take that one back with the team and just check that, and perhaps we'll just make that clear on the website afterwards when we put the recordings up. And Jenny or Louis, can you remind me, do we put the Q&A up as well when we put everything on the website?
Yes, we do. Yes.
Yeah. Okay. So we'll make sure that one's answered for you. Okay. I think then that is everything. I can't see any more questions coming through, but thank you for all the questions that you have put in. That's really, really helpful. Thank you to all of our speakers, both for the presentations and also for the support in the background, providing the answers. So I'll let everyone have an extra 8 minutes of their day back. And finally, just welcome once again and thank you to you all for attending. I hope you found this session helpful, and please continue to keep in contact with us. I've seen a final question about resources for Part 1 and 2. Just to say, there is information on the college website, particularly for the Part 2 examination, which is in person. There is a webinar that is provided for all candidates in advance of each session. So there are resources on the website, but we will point to some of those when we publish those answers afterwards. Thank you very much, everyone. Enjoy the rest of your day and have a great weekend. Thank you.